Pat McGuigan with CapitolBeatOK, and I'm interviewing Christie Herrera, who is a specialist in Medicaid, health issues, fiscal policy. She's from Florida, visiting Oklahoma, and she's been speaking with a number of Oklahomans about Medicaid reform. Christie, tell us what you hope comes out of this visit and similar conversations around the country.
Well, I think the first thing that I hope that Oklahoma would do is to reject the Medicaid expansion. This is something that is absolutely fiscally unsustainable. $11 billion in cost to the states in the first 10 years alone. 250,000 Oklahomans on the Medicaid program. This is a program that can't take care of the patients they already have. So that's the first thing, reject the Medicaid expansion. And second, to reform the Medicaid program that you already have. This is an unsustainable, open-ended entitlement. The state can't run the DMV, can't do the post office. It sure as heck can't run a healthcare program for the poor and sick. And what we hope to do is to infuse some market incentives, the same things people get in private insurance, and make patients happier, healthier, and then get them off of Medicaid and back into private care. We need to do this for patients and taxpayers.
If you don't mind, tell me about the fiscal implications for a state our size as opposed to Florida's size. You mentioned a figure to me before we got on the video of $700 million. Explain that a little bit.
Sure. Florida reformed its Medicaid program back in 2006. They have 300,000 people in this reform program. They are getting better access to specialists than people that are in old Medicaid. They are more satisfied with the care that they're getting. They're getting healthier in a number of metrics like asthma management and diabetes care and mental health treatment. But more importantly, they are saving money. With just 10% of Florida's Medicaid population in its reform, they're saving $118 million a year. If Florida's reform was a state, it would be the lowest per person Medicaid cost in the country. If Oklahoma matched Florida's per person Medicaid spending, you would save $770 million a year. That's about 40% of the program as it stands today. That is a huge savings that can be put in your rainy day fund, can use to hire more teachers, to reform schools, to build roads. It's something that needs to be done, and we have a proven reform that's worked in Florida that we hope that will work in Oklahoma as well.
Thank you for talking to us and for your time.
Thank you.